This one condition can explain between 19 to 37% of female acne cases. This condition is PCOS, which I will be covering in this video. Hi guys, welcome back. Today I'm going to be talking through what is PCOS, its symptoms, how to diagnose it, how it relates to acne, and also how is it treated. So what is PCOS? PCOS is abbreviated from polycystic ovary syndrome. It is characterized by the following: ovaries that have a high number of cysts, the key being a high abnormal number, as healthy ovaries will sometimes have cysts as well. Irregular ovulation, if your menstrual cycle is on quite an irregular schedule. High levels of male androgens, which would appear as a number of symptoms. And then how do these symptoms actually present themselves? Let's go through the list. So it would be acne, excessive hair growth, which is in a male-like pattern, like on the chest or the face. Irregular periods, as we've already said. Obesity is also common, but in particular, abdominal obesity, which is more of a male-type fat distribution pattern. Insulin resistance, which in short means your body doesn't respond to insulin in the same way, which can cause issues for your blood sugar levels in terms of the hormone fluctuations. We are essentially talking about a number of hormonal factors here. The body produces too much luteinizing hormone, which causes the ovaries to produce too much androgens or male hormones. Too little follicle stimulating hormone produced causes the ovulation cycle to be irregular and dysfunctional as well. Then too much insulin from insulin resistance will lead to an excessive quantity of androgens also. So how do we diagnose PCOS? Generally speaking, this condition will first start presenting itself during puberty or adolescence, but it isn't often diagnosed until later as an adult, because some of the symptoms are symptoms that are just quite common during puberty anyway, with fluctuating hormones such as acne and irregular menstrual cycles. These are better signs of PCOS in adulthood, but if you're a teenager, better signs to look out for would be high levels of male hormones, ovaries that have at least 25 cysts, which you would need to get a scan for, and persistent irregular periods that last for at least 2 years after you started your first menstruation. Let's talk about how this condition links into its high correlation with acne. As you probably guessed it, a symptom of this condition, which is higher male androgens or hormones, often leads to a higher production of skin sebum or oil, which often means more acne as well. Studies have shown that PCOS acne tends to appear more in different areas to pubertal acne. Pubertal acne tends to appear more often on the face, whereas PCOS related acne more often on the lower face, the neck, the chest, and the upper back as well. So how do we treat PCOS, and how do we treat PCOS related acne? Well, for acne, as you may know, I would recommend running a good quality skincare routine using high quality non-irritating and non-comedogenic or non-pore clogging ingredients, and Aqneeq's products are an example of that. However, PCOS is part of a bigger issue, and you would probably like to treat the other symptoms of that as well. But for the purpose of this video, I will stick to treating the acne as a symptom of this condition. I would suggest seeing a doctor about this condition to get it treated as well. In terms of the medications that are often prescribed for PCOS related acne are the birth control pill, cyproterone acetate, spironolactone, flutamide, and finasteride. So let's talk about each. Firstly, the birth control pill or combined oral contraceptive is often prescribed. These contain a combination of estrogen and also progesterone as well. These have been shown in various studies to be quite effective for female acne, somewhere between 50% to 87% clearance of acne. So they will often need to be combined with an effective skincare routine for full clearance of acne. As with any medication, these come with some mild side effects as well, which may be nausea, headaches, breast pain, or more severe ones like heart disease or blood clots. The second treatment is cyproterone acetate, which is often prescribed with a combined oral contraceptive. This is an anti-androgen which reduces the levels of male hormones in the body. This again has been shown to help clear acne, but studies haven't been as clear, and this can cause a few issues in the female body, such as loss of libido, weight gain, mood changes, or even more irregular menstruation, or no periods at all. The third treatment is spironolactone, which is also an anti-androgen, which again works by lowering male androgens or hormones. The side effects are similar to that of the previous anti-androgens, such as headaches, irregular periods, and breast tenderness. It has been shown in studies to be effective against excessive hair growth when used on its own, but not so much for acne. The fourth treatment is flutamide, which is another anti-androgen. This is usually prescribed at a lower dose, as higher doses can damage the liver. In terms of its effectiveness, there hasn't been an abundance of studies, particularly being used on its own, but has been studied being used with a combined oral contraceptive, and this was very effective for clearing acne. Our last treatment is finasteride, which is also sometimes prescribed for men with hair loss. This isn't an anti-androgen as such, but it does reduce the conversion of testosterone into a more potent form. This hasn't been as well studied for its effectiveness for PCOS related acne, but it was effective in treating excessive hair growth in women. Its side effects include sweating and hot flushes. Other alternative medications for PCOS acne that aren't hormonal treatments are metformin, which lowers sugar levels in the blood and has been shown to be quite effective in PCOS related acne, and also isotretinoin, which, as we know, is quite a nuclear treatment for acne, and although it's been shown to be very effective for the permanent clearing of acne, it has a whole host of side effects that can be lifelong. So overall, if you are a female, I would suggest seeing a doctor or dermatologist about this condition for a proper diagnosis and to review your treatment options. If you also have a family member or partner with this condition, it's well worth doing your research or your reading up also. If you enjoyed this video or found it informative, I would massively appreciate it if you could share or follow on whatever platform you're viewing it on. Thank you guys, see you soon.